So good afternoon once again. I am your clinical instructor, Mr. Vera Acompañado. So this afternoon, I will be performing the ice cap or ice bag application. So our equipment will be very simple. We have the ice cap or ice bag. So there are types or quality of ice bag that are silicone type. So you can use that one. So in this example, we are using a plastic ice cap. And next would be a bowl containing small piece of ice or cold water. Then clean cloth to cover the ice bag. So this one. We will be using clean cloth to prevent contamination of the patient. So first thing first is to assess the patient. Number one is the treatment order and client's response to previous treatment if used. So you can ask the patient if this therapy is done already from the previous or not. Because there are tendency that the patient may complain previously that she might have discomfort having this kind of therapy. Second, conditions and appearance of the treatment area, edema, local bleeding. So in this area, we will be applying on the arms so to check if there are swelling or edema. Edema means there is any fluids in the interstitial spaces, or sa Bisaya, we call it pong-pong. We will not apply cold compress to edematous area. Another, we can assess the patient the level of pain, if the pain are tolerable or not. So we will be using our pain scale from 0 to 10. 0 is the highest, and 10 is the highest, and 0 would be the lowest pain. And for our planning, again, wash our hands to prevent cross-contamination. We will assemble all our equipments and materials needed. For the implementation, so again, introduce yourself. Ma'am, good afternoon. I am your nurse for today. I am Sir Melo Acompañado. I will be performing ice bag application. Is it okay for you? And if the patient agree, you can proceed to the procedure. So now, first is to fill the bag or ice cap with cold water. Again, in filling the ice bag with cold water, you fill it 3/4 or 2/3 full. So again, you press some air to remove the excess air, and then close it and seal it. The next is to try to check if the ice bag is totally sealed. You can turn it upside down and check if there are leakage, because it can prevent the alteration to the patient. Next, secure the cup. Test for leaks. Place the cup with covered clean towel. Why we need to apply towel on our ice cup? To prevent nerve damage, because directing cold compress to the skin can cause harm to our patient, and that's one of the harm is nerve damage. So in applying the the ice pack to our patient, apply the ice pack at 1/2 to 1 hour and remove it for about an hour before reapplying it again. Okay, so maximum of ranging from 30 minutes to 1 hour on application. So for example, we have a problem in the arms, you can apply this one for 30 to 1 hour of application. The same from distal area to the upper area, to the proximal area. And for also, we can apply ice cap for post-surgery. For example, the patient is post-cesarean section, you can apply ice cap directly to the incision site. Okay? Because during post-operative area, the cold or the ice cap will decrease the pain on the incision part. Okay? So after that, discontinue and do the same to repeat the procedure. On the evaluation, what we will do is to evaluate the client's response. What are the response of the patient if the patient complains discomfort or pain on the treatment. Next would be the documentation. In the documentation, you document the size, the locations, the appearance of the skin during the treatment, whether there would be redness or cold clammy of the skin, nibugnaw na ang iyang panit, so you also check that one. Another, the status of pain, whether the pain from previous treatment or before the treatment and after the treatment, the pain changed or not. So you also assess, you can compare it from prior to administration or prior to application and after application. You can compare the level of pain. And of course, the duration of treatment, how long did you perform the procedure, and the tolerance of pain. So if the patient tolerated or not. So that's how you will perform the ice bag application. That's all. Thank you.